Welcome back to our EMS Incident Command channel. Thank you for continuing to visit our channel with educational, professional development and leadership-inspired content. Remember that if there is something you would like us to cover, leave a comment below and we will tackle it in one of our next videos. Today we are going to discuss the importance of doing a primary survey on every patient. In our profession, the most important thing for us to do on every call is our primary assessment of a patient. There have been some incidents that have hit the news recently that are disturbing. We need to remember why we came into this profession. Our main goal is to help people in their time of need. Their emergency should not be your inconvenience. We need to remember to do our jobs and do it correctly. So let us dive into the primary assessment and things we should be looking for. An initial assessment performed by an EMS professional is a systematic evaluation of a patient's condition to quickly identify and address any life-threatening issues. The assessment focuses on gathering critical information and determining the appropriate course of action. Although the specific protocols and procedures may vary depending on the region and the level of training, the following are typically included in an initial assessment. Scene safety. The paramedic or EMT ensures the safety of themselves, their team, and the patient by assessing the scene for any hazards, such as traffic, fire, or violence. If necessary, they will take steps to mitigate the risks. We have discussed structured risk management in one of our previous videos. We will add the link if you would like to review. Personal protective equipment, PPE. The paramedic or EMT ensures they have the appropriate PPE, such as gloves and goggles, to protect themselves and prevent the spread of infection. Primary survey. This is a rapid assessment to identify any immediate life-threatening conditions. It follows the ABT approach. Airway. The paramedic or EMT assesses and clears the patient's airway to ensure it is open and unobstructed. Without a patent airway, the patient may not be able to breathe adequately, leading to oxygen deprivation and potentially life-threatening consequences. If the airway is compromised due to an obstruction, trauma, or altered mental status, the paramedic or EMT will take steps to clear the airway or provide assistance such as performing maneuvers like the head tilt, chin lift or jaw thrust, and insert an adjunct such as an oropharyngeal airway if needed. Breathing. The paramedic or EMT evaluates the patient's breathing, checking for rate, depth, and symmetry. Breathing difficulties or inadequate oxygenation can rapidly lead to hypoxia, which can cause organ damage and cardiac arrest. Assessing and addressing any breathing problems promptly is crucial. They may provide supplemental oxygen or assist ventilation if necessary. Circulation. The paramedic or EMT assesses the patient's circulation by checking the pulse and assessing the skin color, temperature, and moisture. If the patient is experiencing severe bleeding or shows signs of shock, immediate intervention is required. The paramedic or EMT may initiate measures to control bleeding, administer intravenous fluids, or initiate cardiopulmonary resuscitation, CPR, if cardiac arrest is present. Disability. The paramedic or EMT evaluates the patient's neurological status by assessing their level of consciousness, pupillary response, and motor function. Changes in neurological status may indicate head trauma, stroke, or other critical conditions that require urgent attention. Identifying and addressing these issues promptly is essential to prevent further deterioration. Exposure. The paramedic or EMT ensures the patient is adequately exposed to assess for any additional injuries or medical conditions. This step involves removing clothing and examining the patient's body for signs of trauma, such as fractures, wounds, or burns. Identifying these injuries allows for appropriate treatment and helps in determining the severity of the situation. History taking. The paramedic or EMT gathers information about the patient's chief complaint, medical history, allergies, medications, and any events leading up to the current situation. This information helps in determining the potential causes and appropriate treatments. Vital signs. The paramedic or EMT measures and documents the patient's vital signs, including heart rate, blood pressure, respiratory rate, oxygen saturation, and temperature. These values provide crucial information about the patient's physiological status. Secondary assessment. Once the initial assessment is completed and any life-threatening conditions are addressed, the paramedic or EMT conducts a more detailed examination of the patient. This may involve a head-to-toe physical assessment, blood sugar, and focusing on specific body systems related to the patient's complaint. We will discuss secondary assessment on another video coming soon. By systematically conducting a primary survey, the paramedic or EMT can quickly identify and address any life-threatening conditions that require immediate intervention. This approach ensures that the most critical issues are dealt with promptly, increasing the chances of a positive outcome for the patient. Once the primary survey is completed and any immediate threats are addressed, the paramedic or EMT can proceed with a more detailed secondary assessment and provide ongoing care as needed. Ongoing monitoring. Throughout the assessment and subsequent care, the paramedic or EMT continually monitors the patient's vital signs, reassesses their condition, and makes adjustments to treatment as necessary. Monitoring of the patient should continue en route to the hospital. The paramedic or EMT should be able to catch any changes in the patient and change treatment if needed. Many things can happen in those 5 to 10 minutes to the hospital. Being aware and leaving your patient connected to your cardiac monitor will help you be alerted to changes. We understand that not every situation is as simple as we think. There are many variables during our runs and we must adjust. The one thing that we cannot veer away from is doing an initial assessment. This is the one thing that helps us figure out what our patient might need. Sometimes what we might think it is could be being masked by other issues going on with the patient. We can be thorough paramedics and EMTs by remembering to do the simple stuff. Simple is also important. Remember to always follow your local and regional protocol. Don't forget to subscribe if you are enjoying our videos to get up-to-date information on the channel. Hit the like button if you are enjoying the content. Comment below if you would like to see something specific. Be safe and see you out there.